enter the room.
All right, so good morning. My name is Dr. Antonio. I'm one of the junior doctors working in this respiratory unit. Could you kindly confirm your full name for me, please?
My name is Natalie Tate.
I'm pleased to meet you. How do you prefer I address you as?
Natalie is fine, doctor.
All right, great to meet you, Natalie. Could you also confirm how you're related to one of our patients, Hilary Tate, who's admitted here?
She's my mother.
Okay, and lastly, would you also confirm the age?
She's 70 years old, and I've actually come here to talk to you regarding her condition. She was recently diagnosed with lung cancer, and I want to understand why this diagnosis wasn't made earlier.
Okay, I can understand that. Thank you for sharing this information with me. But before we get into that, I just had a few questions that I wanted to ask you regarding her condition and how she came to be admitted in this center. Is that okay?
Yes, and I'd really like to talk to you about that. I mean, she's been having fever for the past 5 days. We've been continuously giving her this paracetamol. I mean, she's been having fever off for the past 4 months, and every time she's gotten admitted, they just give her paracetamol. And nobody even bothered to investigate any further to understand, if it could be cancer. And now you're telling us that it's cancer?
I can understand your frustration. It's very much justified. But what I'll assure you is that in our center, we always try to do our very best to assist our patients here. Thank you for sharing all this information that has been going on about with her, especially with the fever that she's had and also the previous admissions. But I just wanted to know how much she knew about this current admission and what we've done for her. Could you kindly share that information with me?
Yes, she has been having the same issues. She's been having fever, her cough has been getting worse. And, every time we come to the GP, they say that she has an infection of her chest.
Yes.
And they just give her antibiotics.
Okay.
And doing some further investigations, and you did some CT scan, and then they diagnosed her with lung cancer. Couldn't you have done that before?
Okay. I can see that you're really upset, and I understand that, and I'll do my very best today to address all these concerns you have. I just wanted to know when this diagnosis of lung cancer was made.
Well, she was admitted 2 days ago. And, that's
Okay.
when they did the scan and they found this out.
All right, and you mentioned that they did a CT scan, and that's okay. You also mentioned something about the antibiotics that she's been getting in the previous times and in this current admission. Do you have an idea which antibiotics she got?
I'm not sure. They just told her that it was for her lung infection, and we just kept having that. And it never got better. It kept coming back. It's been happening on and off 4 months now, doctor. 4 months.
I can understand how that's really distressing for you, and I can also realize how that makes you upset. But do you have an idea if she was taking these antibiotics regularly, or if there was anyone to monitor whether she was taking the medications that prescribed for her?
Well, she was taking the antibiotics as she was prescribed. How else would she be taking it?
Okay. And throughout these past few months, did you notice any changes in her appetite or in her mood or even in her weight?
Well, she has been eating less, and
Okay.
her clothes are kind of getting a little loose.
Okay, I can understand that. Who does she usually stay with? Do you stay with her or she's in a care home?
She lives alone, but I visit frequently.
Okay, that's good to know. And from your assessment, how does she really usually manage in the day-to-day activities, like in terms of things that she enjoys for recreation, or do you have any idea how she manages with her mood and sleep patterns?
I mean, she's an old lady doctor. She tries her best. I come and assist her. But now with this ailment, she's not been doing great. And you guys, you haven't even done your job to even tell us if it was cancer, if you didn't even suspect it to be something as bad as cancer.
I can understand that. So with the diagnosis of cancer that is being made, how much do you know so far?
I just know that she's been diagnosed. I do not know anything else. I was hoping if you could just give me an understanding of why you guys didn't even, think about this before and help
Yes,
my.
yes, I can understand that, and that's just why I'm here today to talk to you about her diagnosis. I see here in my notes it says that she smokes 40 cigarettes a day, and she also has a history of COPD. Is that correct?
Yes, that is correct.
All right. So, based on the information that we had about the whole cigarette smoking and the history of COPD, unfortunately, this is one of the risk factors for the diagnosis that we made of lung cancer. How much do you know about how these two are related?
2 minutes remaining.
Yeah, I don't know much about how it is related, but she's been having this for a while. I mean, she's had COPD for the last 20 years, and now all of a
Mhm.
sudden she has cancer, and nobody even gives us like a clue of what it could be, or how it could be related. This is
Yeah,
not make a complaint.
I'm very sorry for that. And fortunately, we do have means for you to make a formal complaint if, because of how you're feeling for how we've treated her. I could refer you to the patient assessment liaison committee services if that's okay with you. Is that something you would be comfortable with doing?
Yeah, I'm going to make sure that I'm going to be doing that. In fact,
Hmm.
do you think that the doctor who diagnosed her with this chest infection will receive a punishment?
Well, unfortunately, I'm not in a position to determine how the complaint would be managed, but what I can assure you is that we'll do our very best to make sure that we get to the bottom of things so that she doesn't experience a similar situation in the future, and as well as other patients.
Don't you
But I
think
just wanted to know,
he should get into some trouble?
well, unfortunately, it's not in my position to say whether or not what kind of judgment should be given. But what I can assure you is that your concerns would be best addressed by the PALS services. And I would like to know from this point where Hillary would be going. Are you going to be taking care of her, or she's going to be uh, going to a specialized care home?
I don't know. I mean, I'm yet to find out more about this. In fact,
Well,
I
we do
think
have,
it's,
yeah.
to the clinic
Move on to the next station.
could have possibly caused her cancer. Do you think so? I just want you to answer that last question.
Well, yes, the cigarette smoking and the infections are indeed a risk factor for the cancer that we came up to diagnose, but we can only know about other risk factors after I get more information from you. Oh my goodness. Wow.
Yes, absolutely, Doctor. Proud. Good job, good job. I mean, this is definitely one of the most difficult cases. This is the case of an angry patient, and especially a patient who is, or a patient relative who is already angry from the beginning.
Mhm.
So
Yeah.
even even as you enter the station, it will be very intimidating. And yes, definitely you have to be on the ground. But what is the most important thing over here? Like, what are you supposed to understand in an angry patient situation?
Well, first and foremost, I think it's important to address the patient's concerns. And in this case, she thinks there was ill treatment of her mother. So I guess that's what I would want to address.
Absolutely, that's correct. That's correct. But even when you're actually going into that, do understand what their expectations are also. You started with the concern, but go ahead and ask the full ice questions, right?
Okay.
Like her idea, like what do you think could have caused? That could be a good question to ask. For her, so apparently she thinks that the antibiotics that were continuously given to her for this chest infection could be one of the causes for the cancer. So what you're understanding from there is that she has a misconception all right? And it's your task to correct that misconception. So every time the patient talks, they're kind of giving you a clue of what your task is. All right. So always
Yeah.
understand what their perspective is. So, you understood that, all right. She thinks that the antibiotics could have caused it. All right. So in my management, I have to bring that in, right? What are her
Yes.
other concerns, right? Every time I came for the diagnosis, you mentioned that she has a chest infection. I mean, every time we came in, there was antibiotics that was given, right? So you know that, certain, features of the disease could actually mimic an infection, right?
Yes, I'm
Un-
following.
So understand a little bit about the, symptoms of the cancer that she might be experiencing. Does she have chest pain? Does she have hemoptysis? Right? Lung related, especially. You asked about the appetite, you asked about the weight, that's good. And now you want to so basically you are trying to get more information from her, like, so in her misconception, she gives you a lot of information, right?
Okay.
Antibiotics when she's been having recurrent infections, right? Old age, immunocompromised state. Understand, what does she have any other medical conditions? I see that she has COPD, smokes, right? So those are also risk factors also that you're getting. So you're getting symptoms, you're getting risk factors. So exploring the patient's concern itself even in the way. So the problem in these cases is that whenever they're giving you information, they're giving it to you in a very intimidating fashion where they're basically screaming
True.
at you.
That's true. That's true. Yeah.
That's what you have to learn, to not respond to. You have to keep the emotions and the information, or aside. Information from the emotions aside. Get the information and then process it, because you're making a management plan for her. And then you asked her, are you going to take her home, or are you going to, going for specialist care? Like, that's not her decision, right? She's definitely going in for the specialist care. She's in the rescue unit. She'll have to probably be seen by the specialist, the oncologist, and there needs to be a
Yes.
plan that needs to be made. So it's not basically her decision. She wouldn't know what to say for that. So that
Yeah.
question that kind of costed you time. So remember, you have 8 minutes. So the questions you're going to ask need to be very focused in making a management plan for this patient. So first of all, it is to address any misconceptions that she might be having, correct those misconceptions, say what is the likely cause for why this could have been missed, apologize that this was missed, understand, validate the fact that it was very distressful for them to continuously come to the hospital for a diagnosis, for a suspected diagnosis, right? And I mean, the suspicion was not even, right? So all of those are because usually when you're thinking along the lines of weight loss, COPD, smoking, recurrent chest infection, you're literally thinking, first thing, as a GP practitioner or any doctor, you have to rule out the possibility of a cancer in an 80-year-old patient, right? So you understand that it has been
Yes.
missed for a very long time. So she has a past history of 4 months of recurrent infection. So you could have asked, how often was she getting admitted? So now that is recurrent, right? So you're understanding that. And what have been given, it goes down and then it comes back up again. Along with that, she has constitutional signs as well, right? Now
I see.
since it's lung cancer, you have to think along the lines of paraneoplastic syndrome, any metastasis, right? You can ask questions along those lines, right? Just to understand, like, what is, like, get the full picture of the cancer that might be affecting her life at this point. So let's quickly look at the points. So ask about the frequency and duration of cough, shortness of breath, fever, and other symptoms. Shortness of breath is also a very good, symptom to ask. Specific cancer, non-cancer related symptoms like coughing blood, chest pain, shortness of breath, wheezing. Ask about cancer symptoms, tired, weight loss, night sweats, assessing paraneoplastic syndrome, notice unusual symptoms like muscle weakness, confusion, changes in her energy level, or unusual pains anywhere in the body, right? Because there might be some cases of hypercalcemia, right?
Yes.
Because yeah, because of the parathyroid mimicking hormone. So the other thing is inquire about GP visits and recent treatment received. Understand the daughter's perspective and concern. So you are trying to get a full picture of the cancer. Along with that, you're trying to understand what were the treatments and the recurrent hospital admissions about, and the daughter's concerns and any ideas, expect concerns and expectations that she might be having, because she will definitely have a thought process for coming and complaining to you. So understand what is the complaint, right? What is the reason behind the complaint? Address that. If she has any misconceptions, try to give the correct answers for that. Explain it in a way that she would understand the correlation why, right? So I understand that you're very
Mm-hmm.
upset, and I am truly sorry for what your family is going through. It's natural to feel angry and frustrated about missed diagnosis. We are here to support you through this difficult time. So that's a good way. So every time you have a patient with or a relative with an uneasy, emotion, try to, address it right away. You say, yeah, especially when you see that the person is angry, address it right away. Say things like, I can see that you're very angry. Could you please explain why you're feeling this way? Right away you have
Okay.
asked a question right away. So then she'll explain, of course I'm angry. I mean, why wouldn't I be? I mean, look at everything that you people put us through and blah, 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 blah. So in that whole sentence, I know most of it might have come out to be offensive, but take out the information out of it, right? The important information that you can use in management. So now let's go into the management. So your mother was admitted 2 days ago with persistent cough and a history of COPD and heavy smoking. Despite repeated GP visit and antibiotic treatment, her symptoms persisted. Right? So she's saying that antibiotics could have caused this. Right? And you are trying to say that despite all that, her symptoms have persisted, right? So that is something more than just an infection, right? So on her last admission, the investigation including the CT scan, we diagnosed her with lung cancer. It appears that during her GP visit, the possibility of lung cancer was not considered and she was treated for chest infection. This might have delayed her cancer diagnosis.
Okay.
You can kind of give an explanation like that, and that's possibly the cause, right? Your mother is now under the care of an oncology team, and we will come further tests to determine the stage of her cancer and the best treatment option. So that is your strategy to be telling her, like, what are the next steps, right?
Mm-hmm. Mm-hmm.
And that she receives the appropriate care and support, right? Address specific concerns, provide details about the GP actions. As I was not involved in her care at the time, however, diagnosing lung cancer can be challenging, especially when symptoms mimic common conditions like a chest infection. Right? That's one way to actually say, do you think they should be, punished? Yeah. It is not within my capacity to comment actions, because it's not your job. So that's a good way to actually say that, right? However, I encourage you to file a complaint with the PALS services. They will investigate your concerns. So you are actually redirecting. It's like it's not basically my role to be commenting on this, unfortunately, but I can, redirect you to the department that does, right? We take all complaints seriously, and any errors will be reviewed to prevent further occurrences, right? Despite many visits, just kept giving antibiotics. It's possible that this causes her cancer. I can understand your concern. I can understand why you're concerned. Currently, there is no evidence about antibiotics that cause cancer. Right. So basically, you're saying that from a factual point of view, right? Currently,
Yes.
we don't have any evidence of such, correlation. Lung cancer is usually linked to other risk factors like smoking, certain environmental exposure. However, if you have any worries about about her treatment history, I will look into her notes and discuss it further with the team if needed. Yeah, so that's actually a good way of redirecting that question. Like as of now, we don't have any understanding of any antibiotics causing cancer. But then, if you are concerned about a particular treatment, I can discuss it with my seniors and team to investigate it further. Right? All right. So let's quickly look at the yeah. Let's look at the performance. So for these case repeat mocks, we usually give the performance in a different kind of format where we also have the.
Hello?
Can you hear me, Dr. Farao? Hi, Dr. Farao. Can you hear me?
Hello, hello. Sorry, I lost the network for a bit that time. You were talking about, we're just finishing addressing concerns, but.
Dr. Farao, are you there? I think your line is
Yes,
getting cut.
hello. I lost the network for a bit, but I last heard you when we were finishing off the addressing concerns part.
Okay, all right. Anyway, we'll look into the checklist, so we'll get back to that again, right?
Okay.
Okay. I'll share my screen to share the checklist. Yeah, here we are. So good job on identifying the patient. Definitely, that's very important to identify the full name and the age of your patient. So your patient, you correctly identified her as Hilary Tate, and this is the daughter that you're talking to. Confirm the daughter's name and relation to the patient. Clarify the purpose of today's conversation and the daughter's main concern. Ask about the onset duration and the progression of the mother's cough. Yeah, ask about shortness of breath, when it started, if if it had worsened, any triggers. Ask about the presence of hemoptysis, any chest pain, right? Specific cancer-related symptoms, right? So that was missed. That was important, but missed. Ask about any paraneoplastic syndrome.
Okay.
Yeah, if you can accommodate. Yeah, not that important, but all right, that's okay. Inquire about the frequency and duration of GP visits and treatments received. Assess the impact of symptoms on daily activities and overall health. That was good. You asked that question. Ask about systemic symptoms like fatigue, unexplained weight loss, night sweats, and loss of appetite. Current medication, that's also very important. She has COPD, so what is she doing at the moment for COPD, right? That's an important question. Ask about medical history because you want to bring up of smoking and COPD to the cancer, right? So you want to bring that correlation about. So definitely ask about any medical conditions if she has any, other conditions to contribute to her cancer diagnosis. So you're looking for risk factors to explain why this could actually happen, right? So you got smoking, you got COPD, so that's good. ICE, we partially asked ICE, so I think I'll give you a partial for this. So you asked concerns, but you never really asked ideas and expectations. So go ahead and ask that, because in that they'll actually pour their hearts out. They'll actually tell you what, what they think could have been the cause of this, right? Validate emotion, acknowledge and empathize with these feelings of anger and frustration. So that is a good way to actually start the conversation. When they come at you screaming, just address it by saying, I can see that you're very upset. I can see that you're very angry. Could you please explain, why you might be feeling this way, right? So definitely understand why and where, right? Explain her mother's current diagnosis in simple language. Cancer, lung cancer confirmed after a recent CT scan. Explain that COPD and heavy smoking are significant risk factors, right? I think you gave this partial, I'll give you for that. Discuss the possible reasons for delay in diagnosis. So that's very important. Like why was there a delay? That's her main thing, right? Why did you guys delay the diagnosis, right? Clarify antibiotics.
Yes.
Clarify that antibiotics do not cause lung cancer. That's if she comes to the question. So that is something that you could have answered. Explain next step that the pathology team will be involved, further testing and investigations will be done for staging and the type of cancers right? Ensure appropriate care under the care of an oncology team, provide necessary support and treatment, address specific concern, that is encourage filing a formal complaint with PALS, thorough investigation. Inform her you will fill out an incident report to ensure her concerns are addressed systematically. Document the conversation thoroughly in the patient's notes for team communication, informing the seniors. So whenever you see that you're getting into a conflict with a patient or a relative, this is something that you need to communicate with your seniors, because they need to know of any possible conflicts that is going to arise. Because ultimately it's their team, they are in charge of the team. So definitely say that, no, I'll speak with my senior about what has happened, I'll document it and inform my team as well about this, right?
All right.
Ensure the daughter that her mother will receive the best possible care moving forward. Follow up schedule for a meeting at the end of the day to review progress and discuss new information. Also to arrange for her to speak with the senior and consultant if desired, right? Safety netting, advise her contact the ward immediately if her mother's breathlessness worsens, if she becomes confused or any sudden changes occur. Offer her information leaflets about cancer and available support. Offer counseling services to support the family emotionally through this diagnosis. That's usually the Macmillan service that you can actually offer.
Okay.
Otherwise, a couple of interpersonal skills: express support, acknowledge the daughter's emotions, and provide comfort. Express empathy by stating you are sorry for what the family is going through. Use simple language, explain medical terms. Explain medical terms and diagnosis in layman terms, right? Check understanding to ensure the daughter comprehends the discussion and invite questions. Patient-centered approach, involve the daughter in discussions and the next step and care plan. Active listening, encourage the daughter to express her concerns and reassure, offer her hope and support for the future care of the patient. All right, let's look at a couple of the points. So consultation, even I also feel that the consultation was a little off, there needs to be a structure in which you have to gather the important points relevant for you to get into management. Issues, definitely you need to understand the issues. What were the issues of this space? Like, what are the things that you need to address, some misconceptions, the reason why there was a delay at all, right? Management, rapport, and time, yes. All right, so that was your first try, Dr. Farao. Good job.
Please like and subscribe to Turing Med School. Good luck with your preparation.